All right. We're going through this page by page. I apologize for that. So we've got our fingers and our toes, our calculators, whatever people are using just to crunch what the CBO, in fact, has crunched on the Senate Finance Committee's health care plan. That is the Max Baucus plan that seems to be the one most favored by the White House and the one that generally gets the most buzz about getting support than any other. And the CBO, which scores, is sort of like the teacher, you hand in your assignment and you cross your fingers and hope the teacher grades it nicely. And the teacher in this case has. The CBO saying that this will reduce budget deficits by about $81 billion over the course of the 2010 to 2019 period. Now that's trillions over that period of time. What they're effectively saying is, well, $81 billion isn't chump change in the scheme of things. It really is. But the CBO is saying this will not add to the deficits. In other words, this will fulfill the president's obligation of being, as you hear so often, deficit neutral. There are a lot of other details in there. The cost of those added insurance coverage, if you have an elite policy or particularly generous insurance coverage, that's going to be taxed at a higher rate. And that will, in fact, be very, very costly, but it's offset by all these other credits and everything that gets you to that net number that this is not going to add to net deficits. We shall see. Republican Senator Lindsey Graham joining me right now. He is a member, by the way, of the Senate Budget Committee. Again, Senator, these numbers coming in fast and furious, but knee-jerk, the CBO says, okay, kind of. What do you make of it?
Well, it's not going to happen because to get to $81 billion in the black, you have to assume the Congress will cut $400 billion out of Medicare over a 10-year period. You got to assume that the taxes we levy on the economy won't hurt the economy, and these Cadillac plans that have a 40% surcharge, that companies won't drop the plan because the tax is so high. So we're never going to do the things you need to make it deficit neutral. We're not going to cut Medicare by $400 billion. And these tax increases, your last guest talked about opposing a tax increase on medical devices. Well, that's going to be gone, and there'll be others to follow.
And in other words, once those revenues go, then how do you make up the difference? I see where you're coming from, Senator. Then if you're the president, right, and you're watching in the White House now, and no doubt you've got the same report that Max Baucus does, what are you thinking? What are you strategizing now? We do know that this crucial Finance Committee vote has been put off about a week. What do you make of that?
Well, I think you try to spin it that it meets the president's desire to not to add to the deficit, but it will increase taxes on people that make less than $200,000 because the premiums increase. We passed on to consumers. If I were the president, I would basically start over, try to find some common ground here and abandon these big plans that have $800 or $900 billion in additional revenue to be offset, because you're not going to be able to legitimately do it if the way to get there is to cut Medicare. It is just a hopeless endeavor. We're not going to cut Medicare by $4 billion over 10 years, much less $400 billion. And if we take a penny out of Medicare, we ought to put it back into the Medicare system because it's going bankrupt, not help pay for the uninsured. There's a better way to do that.
Well, the chairman of that Finance Committee, Max Baucus, obviously slightly disagrees with you, Senator. He's just put out a statement here, and I'll get to the gist of it. He's saying that our balanced approach to health care reform has paid off yet again, with the news today that America's Healthy Future Act, this Health Care Act, is fully paid for, begins to reduce the federal deficit within 10 years, and make significant reductions in federal debt, going on to quote this $829 billion figure over 10 years, which is less than the $900 billion that was first bandied about. I don't know how these numbers swing so wildly, but he likes the way they're swinging. You don't believe the way they're swinging, right?
Well, because the Congress, I've been in the Congress for 14 years. We reduced doctor payments. Remember the doctor fix from the 1997 Balanced Budget Agreement? Every year we forgive what the doctors are supposed to pay to get to a balanced budget. The doctor fix over the next 10 years is $283 billion. They don't have a solution to the doctor's fix. I would argue, based on the past performance of the Congress, we're not going to cut doctor fees $283 billion over the next 10 years because we haven't done it over the past 5. And we're not going to reduce Medicare by $400 billion over the next 10 years because 2 years ago we had an amendment to control Medicare spending by $33.8 billion over a 10-year period, and it got 24 votes.
So you're you're saying the Congressional Budget Office is smoking something.
Is assuming something that won't happen.
So the CBO is wrong.
The CBO is right if you assume the Congress will do what the bill says. If we cut $400 billion out of Medicare over the next 10 years, I will buy you a new car. That's not going to happen. We have never done that before. There will be riots in the street if the benefits of senior citizens are reduced by $400 billion over the next 10 years to go to pay for bigger government and health care for the uninsured. That's not going to happen.
Senator, while I have you here, another thing I know you're quite passionate about is Afghanistan. You want to see troops added there. The president is huddled again with some of his defense team discussing Afghanistan after meeting with congressional leaders yesterday. Where do you think this stands? What do you want to see?
I want to see better security as quick as possible. I want to reinforce the troops who need help. I don't want any more outposts overrun because we don't have enough troops. I want the president to listen closely to the generals, quietly deliberate in a private setting, and make a decision that will allow the 68,000 to be reinforced, put the troops on the ground we need to be successful, to take back from the Taliban the ground they've gained and have a second chance at governance. Without better security, we're going to lose, and without reinforcements, the 68,000 are sitting ducks. I want the president to act decisively, follow the general's recommendation of more troops.
Senator Lindsey Graham, thank you very much.
Thank you.
All right, again, just up to